Hello, I'm James Hackney, and I will be teaching you biomechanics. My PhD from University of Minnesota is in biomechanics, so I really love this subject. I hope that you like it too, and I can't wait to meet you in real life. Everybody here wants to become a good physical therapist. You can work in a variety of settings, including sports and orthopedic, or on the opposite end of the spectrum, you could work with very sick people in the intensive care unit. But there's a few really important principles that you have to remember, whatever setting you're working in. And they transfer from one setting to the next. The process of physical therapy, you see, should be like a flowchart rather than like a checklist. Your patient comes in and say, for example, he comes in with a diagnosis of shoulder pain. Well, shoulder pain can be lots of different things. So you start by listening to the patient's story and finding out about his or her symptoms. Based upon that, you begin to think about what's going on and select some tests or measures. You'll find out, if you haven't already, that there are dozens and dozens of tests and measures that you could potentially do, so you don't want to do all of them. Based upon the combination of what you've heard subjectively and what you've measured, you come up with a clinical hypothesis, and your treatment is testing that clinical hypothesis. If your hypothesis is correct, then the treatment will make a measurable difference within a finite period of time. If it is not, then you revise your hypothesis and go down the path of an alternative treatment. If that still doesn't make a difference, then you perhaps come up with a third hypothesis, which yields a third type of treatment regimen. This is actually sounds perhaps rather daunting, but it's actually really fun and gratifying because you're solving a puzzle. What you really need to be a successful physical therapist is intellectual flexibility. Please allow me now to address some questions that people have a lot of the time as they start this program. In this class, all the test questions, and there will be some tests, we'll talk about those in just a minute. The test questions are intended to be broad concept. I'm going to try really hard not to try to trip you up with little trick questions or trap you into language. The concepts that you will learn in class will actually really help you design rehabilitation programs. This isn't just busy work that you need to do in order to get to the important stuff. This is important stuff that will really help you be a good physical therapist. I think that if you understand principles of anatomy, kinesiology, and biomechanics, that you'll really be able to develop helpful treatment regimens for 70, 80, 90% of your patients. And then finally, one of the things that I'm going to ask you to do, especially when you're not coming into campus and you're by yourself to help learn these concepts, we call kinesthetic learning activities. However, if you have some sort of injury that might endanger you for injury in a kinesthetic learning activity, please let me know and don't do it. We'll come up with some alternative instead. Now, in order to be a successful physical therapy student, you need to be strong and brave and gentle and kind. You need to be strong, first of all, because physical therapy school is really hard. You need to be brave because you can't be afraid of making a mistake. You need to try and make mistakes. Being timid isn't a good way to learn. But then you need to be gentle and kind also because you're a team, and you need to depend upon each other. In fact, we're all a team, and we all need to depend upon each other in order to ensure that you have the best learning experience and become the best clinicians that you possibly can. The score in this class comes from a few things. First of all, the biggest thing are called the quests. Now that expression came from one of Dr. Wallenstein's students when he was teaching this class. The student said to him, you know, these tests that you give, they're a little less than tests, but they're a little more than quizzes. And they're like quizzes and tests together. They're quests, and we both thought that that sounded like a really good description of what these are. They're quests for knowledge and improvement as a physical therapist. The second thing that we're going to be doing are small group discussions. We'll describe a little bit how that's going to work the first time that we meet over Zoom for a synchronous discussion group. But there'll be questions that are assigned to small groups, and those small groups should come up with explanations for those questions. And there's some small group discussing right there. And then finally, we talked about this a little bit a couple minutes ago, kinesthetic learning activities. Kinesthetic learning activities are actual things that you're going to be doing that will help you understand some of the principles of biomechanics. There'll be some sort of output for those learning activities. It might be a video that you can make yourself or some sort of score or output that you're going to record and send to me. So I'll be looking forward to those, and that's where your grade is going to come from for this class. I want to tell you now some things that will help you thrive both as a physical therapy student and in this class in particular. First of all, you are not learning several tens of thousands of disconnected facts because you'll never be able to learn it that way anyway. Instead, think about the relationships and then conclude what is going on. For example, think about the muscle latissimus dorsus. It attaches in the medial lip of the bicipital groove of the humerus and then proceeds medially and inferiorly to the thoracolumbar fascia. So if you remember that, then you do not have to memorize that it's an internal rotator, an extensor, and an adductor of the shoulder and an extensor of the lumbar spine. You just picture that muscle shortening, and then you can figure out what it needs to do. Now remember, when you think about anatomy, form follows function. Things are the way they are because they work really well that way. We've got millions of years of evolution that helped it become as such. So when the postural relationships, when the structure, when the muscle recruitment patterns aren't as they are for healthy people, then normally there's consequences to that. We'll talk about that a lot over the course of the semester. So I'm certain that as you start to learn this stuff, it'll feel like you're trying to take a drink from a fire hose. So you need to be able to filter what you're learning and think about what is really, really important. And if I could give you a hint for that, when you hear the same sort of content in different settings, for instance, you hear it in anatomy, you hear it in kinesiology, you hear it in the musculoskeletal treatment, you hear it in neurological, then you know that that's the really important stuff. Okay, so having discussed how to learn in physical therapy school and in this class, let's go ahead and start talking about what we're going to learn. The first thing is the science of kinematics, which is the description of motion that we can think about. All motions that we will be studying can be classified into three types. First, there's the rotary, or rotating around an axis. We'll talk a little bit more about that in just a couple minutes. The translatory, which is not rotating around an axis but going in a linear fashion. If you look at the diagram of the person moving his hand toward a glass, then you see that in order to have a translatory motion of the hand, you also need to have rotation of some of the joints of the upper extremity. And then finally, what we call general plane motion. And general plane motion, like we see in this very cute, if not very safe example, is both transitory and rotary motion going in the same plane, which is a sagittal plane in this case. Let's review the planes through which motion takes place and the axes through which joints rotate around. Now, you've all seen diagrams like this dividing the body up into its planes, and we'll just briefly go through this. The sagittal plane is that plane which divides the body left to right. There can be in any number of sagittal planes, but they're always dividing left to right or medial to lateral. The frontal or coronal plane is that plane which divides the body front to back. Again, there can be any number of coronal planes, but they're always dividing front to back. And then finally, the transverse plane is that plane which divides the body top to bottom. Again, any number, but also that top to bottom division. Now, when we think about the axes of joint rotation, the axes are perpendicular to the direction of motion, and we always name these with anatomical position on mind. And here you see a diagram of anatomical position. So the medial lateral axis is what motion in the sagittal plane takes place around. So for example, when the elbow flexes and extends, it's flexing and extending around a medial lateral axis of rotation. The anterior-posterior axis of rotation is what movement in the frontal plane takes place around. So for instance, abduction and adduction of the shoulder or hip take place around an anterior to posterior axis. And then the longitudinal axis is what rotation in the transverse plane takes place around. So for instance, rotation of the head, internal and external rotation of the shoulder or the hip all take place in the longitude around a longitudinal axis. Now, of course, in normal human movement, rotation around exactly one axis or through exactly one plane almost never happens. When we're moving normally, we're almost always moving through three planes at the same time, as you see with this diagram of a pitcher. Actually, pitching is one of the things that I study, and this isn't a very good drawing, but it gets the idea across. Okay, so we see, if we think about the trunk or the shoulder, we see the pitcher moving in the sagittal plane, the frontal plane, and the transverse plane all simultaneously. Now we're going to talk about how we quantify movement. Those of you who have taken calculus will recognize these relationships. However, we're not going to talk about calculus anymore because life is hard enough already. So in the linear sense, displacement is the same as distance. So that might be measured in centimeters or meters, or that's the amount of distance something is covered moving from point A to point B. The rate at which it's moving is also called the linear velocity, and that is measured in meters per second usually. Now, the rate in which a velocity is changing is called acceleration or linear acceleration, and that is measured in meters per second squared, and that can be either positive acceleration, that is getting faster, or negative acceleration, or getting slower. Now, remember that joints are generally rotating around axes. So when we talk about the speed that the joints are rotating, we're thinking about the angular movement. So the displacement is called the range of motion, or the joint angle that a person is making, and that is usually measured in degrees. Sometimes mathematically we talk about radians as well, but in the sense of physical therapy, it's almost always degrees. Angular velocity is how quickly that joint is rotating. So the angular velocity is measured in degrees per second, and the change, the rate of change of the velocity is angular acceleration, which is measured in degrees per second squared. And like linear velocity can either be positive or speeding up, or negative, which is slowing down. Now that we've talked about motion, let's talk about the elements that cause that motion. First, if the motion is linear, then the element that causes it is force. As you see here, it is going in exactly one direction and not rotating around an axis. When the motion is rotating around an axis, then what we're actually talking about is torque. And torque is a really important thing when we think about biomechanics, because when the biceps flexes the elbow, what the biceps is doing is causing a flexion torque at the elbow. When the quadriceps extends the knee, what the quadriceps is doing is creating an extension torque at the knee. As a matter of fact, when we know what direction the torque is going on, such as elbow flexion or knee extension, then it's called a moment. And torque is, or moment is torque with the direction defined. Now, the main force that works upon us here on Earth is gravity. And your whole body has a center of gravity, and the body segments relative to each other also have a center of gravity, which we'll explain a little bit through this upcoming slide. So here we see a guy from the 30s or 40s, based upon his haircut and how he's dressed, but he's about to punt a football, and that hasn't changed much since that time. So you see he's leaning forward a little bit with the football, and his arms are forward, so his actual center of gravity is a little bit forward of his body. Now he's stepping forward, one leg forward, one leg back, and because he is leaning backwards a little bit, even though his arms are forward, he's moved his center of gravity backwards. So now his center of gravity is going straight down through his pelvis. Now look what he's done with his trunk, which is the most massive body segment, to be sure. His trunk is leaning backwards. So because his trunk is leaning backwards, now his center of gravity is back in back of his supported foot. Now we see here he is very flexible with that punt, and he's able to move his leg way up. So the moment arm of gravity, and we'll talk about this, and we have a lab coming up about this, has actually shortened a lot because the amount of his leg that is presenting to gravity has shortened because it's so vertical. So he has been able to move his center of gravity back underneath his body. So here you see same body, just fractions of a second apart, but where the center of gravity is really depends upon the arrangement of the body segments. Let's discuss some important relationships between mobility and stability. The more stable you are, the harder you are to move, so the less likely you are to fall over, but the more energy it will take in order for you to move. So the things that affect the stability of the body include the line of gravity. The line of gravity must always be within the base of support. So we see, for instance, with this offensive lineman, he's got his feet spread very wide, and he's got his hand on the ground in a three-point stance, so his base of support is this wide triangle, and his line of gravity can be well within his base of support really easily because his base of support is very wide. Also, his center of gravity is very low, so he is very stable, and this is the job of an offensive lineman, right? For the ballerina, on the other hand, her height of the center of gravity is very high relative to her body size, and her base of support is just the toe platform of her toe shoe. So a very small area in which she has to maintain the line of gravity. Let's talk about Newton's laws of physical mechanics as they relate to human biomechanics. A really important example is a law of inertia, and that means that bodies that are moving tend to stay moving at a constant rate, or in other words, inertia is resistance to change in velocity. And so we'll think about the example of walking. You may know this already, and if you don't, we're going to talk a lot about this, but the swing phase of walking is when the foot is moving from one point on the ground to the next point on the ground. And the knee bends at the beginning of the swing phase, not because the hamstrings are bending the knee, but mainly because of the inertia of the thigh and of the foot and shank segment. The thigh goes forward, but the shank and foot resist that change in velocity, so that's why the knee bends. And then toward the end of the swing phase, the knee straightens, again, not because the quadriceps are doing the work, but again because of the inertia of the shank and foot segment. The thigh slows down, the shank and foot keep going, and the knee straightens because of inertia. The second thing is the law of acceleration, which just defines what acceleration is. So in the linear sense, acceleration is force over mass, or force is mass times acceleration. In the angular sense, angular acceleration is torque over moment of inertia, or torque equals angular acceleration times moment of inertia. And then finally is the law of action and reaction. In other words, Newton described it as every action has an equal and opposite reaction. So if I push on the wall with a force of 5 pounds, then the wall is pushing back at me with a force of 5 pounds in the opposite direction. And it continues with me pushing harder and harder until finally I push over that wall. Are important to think about in human biomechanics because that's how muscles get force to the bones so that those muscles are able to move the bones. Many muscles are shaped like a spindle, such as a bicep, or like a strap. And those muscles have a linear force system. That is, all the force generated by that muscle goes in one direction, or two directions, two opposite directions actually, facing toward either attachment of the muscle. Here you see the biceps as an example. Another type of force system is a concurrent force system, and those you see in muscles like the pectoralis major. Now, like the diagram over on the left, you see that the figures are pulling in two different directions, but as a result, you have a mathematical product, and we'll go over later how to find exactly what that force would be, but a mathematical product of both of those vectors, those directions of pull. Now, in muscles like the pectoralis major, like the deltoid, like the gluteus maximus, like the latissimus dorsus, you see fibers going in an array of directions, and they are such because those muscles that they move are ball socket joints. And so, as such, the muscles need to be able to provide tension over a wide array of angles. So these fan-shaped muscles, like the pectoralis major, are a good example of concurrent force systems. Parallel force systems are when you have two or more forces acting on the same object parallel to it, but at a distance, and rotating it around an axis. So in your life, a steering wheel is an example. If you're turning, you're pulling down on one side and up on the other. In your body, the scapula is a good example. So here we see a scapula or shoulder blade, the upper trapezius pulling in one direction, and the serratus anterior pulling in an opposite direction with the muscles working together. They call it upward rotation of the scapula. So you may have learned that muscles have origins and insertions. But it's actually more accurate to think of muscles as just having attachments, because they have exactly one job, which is to pull on all attachment sites. So for example, if you think of the woman doing the squat in the GIF over here, and think about her legs, her feet are not moving, so her feet are stationary, and the rest of the body is moving over the feet. So that definition of origin and insertion, which you may have learned before, doesn't really apply in this case. More accurate to think of muscles as moving on both, pulling on both the distal and the proximal attachment sites. Now, muscles do work. And positive work is when the muscles are getting shorter from longer and moving against gravity, like you see in coming up from the squat exercise. Negative work is when the muscles are working, but they're lengthening and the center of gravity is going down. So negative work is the eccentric, it's called, phase of the exercise, or going down against gravity with the muscles lengthening. But there's also isometric work. Now, for those of you who have tried stuff isometrically, you know that the muscles are working. And although it doesn't fit the definition of work, isometric work is definitely a lot of muscular effort. There's just no movement associated with it. Now, we described a little bit earlier vectors. And vectors can refer to forces or torques in this case, but they have certain quantities. You have an origin, which we see here, and a direction, which we see by the arrow over here, and magnitude. So hopefully you've enjoyed a particular movie that will help you remember those characters of a vector. That direct vectors have direction and magnitude, right? A few minutes ago, we described the expression moment in referring to a type of torque. And moment is just torque with the direction identified. In other words, moment is the vector quantity, and torque is what's called the scalar quantity. That is, the direction is not identified. Remember, vectors have direction as well as magnitude. So for both moments and torque, in the definition that we're going to be thinking about over the next couple of semesters, you have a fulcrum, or an axis, or a pivot point, which is usually a joint axis. And the moment arm is the perpendicular distance from the point of application of the force to the axis of rotation. This is a really important idea, so we're going to be spending a little while thinking about it over the course of the next few lectures. So torque, as we said, equals force times the distance from the axis of rotation, as does moment, except in the case of moment, the force is a vector. In other words, it has a direction. Usually in human movement, that direction is straight down because the force is gravity. The language we use in biomechanics describes that anything outside a joint that can cause rotation is an external moment. And things inside the joint that can cause rotation are called the internal moment. We'll describe more about what that is in just a minute. But first, let's think about external moments. So we'll use this example of a person running as his foot touches the ground. And he is experiencing an external knee flexion moment. And that external knee flexion moment is a summation of all sorts of torques imposed by forces acting upon the body. The biggest one is gravity, but also the acceleration of body and other limb segments, the length of the external moment arm, and we'll show you that in a little bit more detail in just a minute, and sometimes, not in this case, but sometimes from other external resistance, like a barbell or an opposing lineman during a football game. So here I'm going to show you what these things mean. Here is the knee joint axis of rotation. Here is the ground reaction force coming up from the ground toward the runner's body. And here, this is really important, is the external moment arm. That is, as we described before, the force that is perpendicular from the ground reaction force vector going to the axis of knee joint rotation. And that, in this case, that moment arm is 20 centimeters or 0.2 meters. So now we're looking inside the knee. The main source of internal moment is active muscle tension, as demonstrated by that vector that you just saw fly in. But also at high speeds, the elastic energy of connective tissue is really important. What we're going to think about when we think about internal and external moments are what are called static equilibrium equations. And static equilibrium is what is taking place when the body, of course, is still, but also when the body is moving at rather slow speeds, not in running, perhaps not in walking, but certainly in doing a squat. So the torque, or the moment, must be very close to the external moment, although the internal moment arm is much shorter. So here's the knee joint axis of rotation, and there is the internal moment arm of the quadriceps acting upon the knee. There is the length of the moment arm, 5 centimeters or 0.05 meters, and therefore, in order for the torque to be equal, the quadriceps force must be much greater than the external force of the ground reaction. So let's do the static equilibrium equation together. Say the runner weighs 150 pounds, and the initial contact force is about 3 times body weight, and this is actually about what happens. So it's 450 pounds, and since we're scientists, we think about things in the international units, so 2,025 newtons. The external moment arm is 0.2 meters, and therefore the external moment is 405 Newton meters. Now remember, in the static equilibrium situation, the internal and external moment have got to equal. That's why they're called static equilibrium equations. So the internal moment arm, or the muscular moment arm of the quadriceps, is 0.05 meters. And in order to have static equilibrium, the quadriceps force must equal 8,100 newtons or 1,800 pounds. And that's actually about what happens. Now, the main source, this is really important, the main source of joint compressive forces are active muscle tension, but it's not the total force. So the internal force is 8,100 newtons or 1,800 pounds, but there's also the ground reaction force. And you put them together, and it comes to 10,125 newtons, or over a ton of compressive force on the knee. And that is actually what happens. Luckily, healthy knees are meant to take it.